Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 2 of a counselling session with one of my clients, and the question last week was: my mother is in long-term care with tracheostomy, on the ventilator and in kidney failure. When is enough? Enough. Part 2. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my husband suffered a heart attack, has been in an induced coma for over 3 weeks now and is not waking up. What do I do? Help. This question comes from Martha, and it formed part of a consulting and counselling session with me over the phone and via email. So, Martha has the following problem, and she writes: Hi Patrick, my 65-year-old husband suffered a major heart attack on the 16th of April and was in an induced coma for over a month. He was intubated for 3 weeks and now has a tracheostomy. The process of taking him off the fentanyl and the midazolam is taking very long. He gets very agitated and upset, almost as if having withdrawal from the drug. This in turn makes his pressure and heart rate go up, and they raise the drug again. Is there anything I can do to help him to come through this? I try to keep him calm, and as the hours pass I see more of him come out, but then they sedate him again and the process starts all over again. They just started giving him phenobarbital. They try to wean him off the burst and the midazolam, and they are transitioning him to a fentanyl patch. It feels like a never-ending wheel. I really want him off the medications, but don't want to hurt him either. The intensive care team thinks he may have had a stroke, but being there with him all day, I don't believe that to be the case. My husband has no other pre-medical conditions. Is there anything I can do, and is this the process for weaning? I feel that the longer he's on those drugs, the more dependent he becomes, and the more his body starts to weaken and shut down. I truly appreciate your help and support. It's very difficult to watch my husband go through this. We have always tried our best not to use any medications unless absolutely necessary, so that makes it even harder to deal with. Thank you again, Martha. So, here's my response. Hi Martha, thank you for your question and for signing up for one-on-one counselling with me. I'm very sorry to hear that you and your husband are in such a difficult situation. Waking up after a prolonged induced coma, 1 month in an induced coma is actually a very long time, can be very challenging, especially if the medications being used are fentanyl and midazolam or versed. Fentanyl is a strong painkiller and is an opiate, and midazolam or versed is a strong sedative, and it's also a benzodiazepine. Both drugs, fentanyl and midazolam or versed, make critically ill patients in intensive care addicted to those drugs, especially after long usage. In a prolonged induced coma, and 3 weeks is a prolonged induced coma, both drugs are drugs of choice and work well to keep a critically ill patient in intensive care sedated, and they also come with the side effects that are mentioned, and those side effects are usually undesirable. Therefore, both drugs, fentanyl and midazolam, need to be weaned off gradually in order to wean them off slowly, so that your husband is not going through withdrawals from the drugs. The agitation that you are referring to is most likely caused by withdrawing from the drugs. You're also asking if your husband suffered a stroke, but if your husband has suffered a stroke, then waking up and assessing your husband's neurological condition is getting even more difficult. Therefore, in order to find out whether your husband had a stroke, they need to do a referral to a neurologist and do a CT scan of his brain. In the CT scan of the brain, they can actually find out whether your husband had a stroke or not. And also the neurologist will do some very special testing so that he can find out whether there are any stroke symptoms or not. Coming back to the withdrawal process, effective ways of managing the withdrawal process, the agitation and also the waking up phase are to use other drugs such as clonidine, dexmedetomidine, or the trade name for that drug is also Presidex. They can also use Valium or diazepam, haloperidol and or quetiapine in order to wean your husband off the fentanyl and the midazolam or Versed. I have never heard of phenobarbital given to get critically ill patients out of an induced coma. If anything, the drug keeps people sedated even more. You need to check with the intensive care team why they are giving the phenobarbital. Nevertheless, even if other drugs are used, waking up after a prolonged induced coma is challenging, and the situation you are describing is a very common situation after a prolonged induced coma in intensive care. Besides the drug therapy, good nursing care such as getting regular washes or showers, regular mouth care, getting out of bed and also getting some natural daylight can often help and improve the situation. There is such a strong emphasis on drugs, which can be important. However, getting good nursing care is highly underrated. It's also important that your husband will rest at night with a good night's sleep and is awake during the day. Most critically ill patients in intensive care have a disturbed day and night rhythm, and that contributes to the agitation. Things that you can do are to ask for good nursing care and also find out what they are doing in order to manage the withdrawal from the fentanyl and the Versed or the midazolam. If you are not happy with the way things are being managed, you need to get comfortable in speaking up and ask for what you want. I can certainly help you managing the intensive care team so that you can make informed decisions, get results faster, and have peace of mind, control, power, and influence. You may also want to find out whether your husband is enrolled in a medical research study, because often critically ill patients are enrolled in studies that they don't know about, and sometimes this impacts on which drugs they can have or they can't have. Don't be shy and don't be intimidated by the perceived power and the perceived authority of the intensive care team. Also, be patient. Waking up after prolonged induced coma is a process and not an event. It's like switching on a light with a dimmer and not with a switch. It's often 2 steps forward and 1 step back. Therefore, you need to give your husband the time he needs to work through this challenge in his own time. I hope that helps, and let me know when I can talk to you again next time on the phone. Thank you. So, how can you become the best advocate for your critically ill loved one, make informed decisions, and get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies or send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find phone numbers on our contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counselling with me via Skype or over the phone or via email by clicking on the email and phone counselling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com and I'll see you again next week in another update.